And that is the exercise part, probably not as fun as the eating part. But Dr. Jonathan Wright is a professor in the Department of Urology. He's a surgeon who's had a lot of interest in understanding the role of exercise in cancer prevention. I'm sure he's going to tell you all about why you should join Obliteride and ride your bike and go on the walk, but he's got other things. So, Jonathan.
Thanks, Pete. I really appreciate being here today. Thank you all for coming. It is a tough day to fit in exercise as we sit inside here for several hours and then you go outside and it's pouring rain, but there are ways to still get exercise, and we'll talk about a few of those things. So I do have a real passion for not just the role of exercise, but also diet and a healthy lifestyle and its role in prostate cancer. So there's quite a bit of data out there that there is an important role for exercise, not just in prostate cancer, but for almost all cancers. Here's a list that shows regular exercise is associated with a lower risk of colon, breast, bladder, endometrial, kidney, and of course, prostate. This is kind of like the slide Dr. Neuhauser showed. It's pretty complicated, and we really don't know what the exact mechanism is that exercise is influencing cancer. And that's one of the things that we certainly are trying to do, is to figure out which of these pathways. It could be inflammation, it could be insulin and insulin-like growth factor, it could be other things, but the bottom line for us here today is that all of it works down on the cancer cell. So what are some of the data about prostate cancer and exercise? Well, if we take a group of men that don't have prostate cancer, and this has been hundreds of thousands of men that have been studied, and we look at how much they exercise, it's been shown that men that do a moderate amount of vigorous exercise have a lower risk of not only prostate cancer, but importantly more aggressive cancer and more advanced cancer. Men without prostate cancer that exercise more are less likely to develop aggressive or advanced prostate cancer. And then we take men that have prostate cancer. Those men that exercise more, studies have shown, have a lower probability of having that cancer progress compared to those that exercise less, and have a lower probability of prostate cancer-specific mortality. For those of you who are on ADT, these pictures make a lot of sense to you. These are actually identical twins. 1 year ago, before this photo, they looked identical. The man on the right was diagnosed with metastatic prostate cancer 1 year before this photo, and has been on ADT for a year. This photo was taken when the second brother came in a year later and was diagnosed with metastatic prostate cancer and was about to start ADT. And he asked the doctors, what can he do to help prevent what's been going on with his brother in 1 year's time? He's gained weight, significant central obesity here. He's lost muscle. His lipids and glucose control have gotten worse, having more fatigue. And his bones have become weaker. This side view, you see the bending of his spine here. Both brothers have osteoporosis. But after 1 year of ADT, this brother has multiple compression fractures in his spine. A lot of these things can be counteracted with exercise. Let's take fatigue, very common with androgen deprivation therapy. This was a survey, and up to 40% of men on long-term ADT reported fatigue, not just fatigue, but fatigue that interfered with their daily life. And there have been studies now, and I've shown some of these before in these talks, that exercise can improve that. And it doesn't really matter if it's cardiovascular exercise or if it's resistance exercise. Your fatigue improves on ADT with exercise. And what's interesting in the studies, and I think is really encouraging in the studies, that those that have the worst amount of fatigue at the beginning of the studies, or the lowest level of vitality, they see the biggest improvement in their energy, their vitality, their fatigue when doing an exercise program. So if you're sitting there thinking, well, I am so tired, I can't even do anything, you're the type of person that actually, when they can do one of these programs, can see the biggest improvements. I'm going to go through a couple of different studies that have been published really in the last 6 to 9 months. This was a survey of men with prostate cancer on androgen deprivation therapy. They asked them, how much do you exercise? A bunch of surveys quantifying how much exercise they did. And then they asked a number of different surveys about quality of life, et cetera. And those that get 150 minutes reported getting 150 minutes a week of moderate activity, which is exactly what the American Cancer Society recommends for all of us, had improved self-reported masculinity, physical well-being, prostate cancer well-being, and overall quality of life. This study looks at how long someone had been on ADT and whether or not exercise can be effective. They took men that had either been on it for 6 months or for 18 months. And they randomized these men to either 2 times a week for 6-month intervention in small groups, or just general recommendations about trying to remain active. The study found that all the men, whether they had been on 6 months or 18 months, had improvement. But those that had been on ADT for longer saw the greatest improvements, similar to the fatigue vitality study earlier. Those that had been on it the most and had the biggest negative impact of the ADT had the biggest improvements in their lean mass, increased lean mass, decreased fat mass, and both improvement in lower body and upper body strength. This study looked at not just resistance, but combining aerobic exercise too. Again, men that have been on ADT, they were actively on it, they were taking ADT. The intervention was, again, a twice-weekly program with some home activities as well. The controls were given usual care. What did they see? Their cardiovascular health improved. They prevented the weight gain that came with ADT. They prevented the increase in fat. And they maintained their lean body mass with the initiation of ADT by doing the exercise program. And they saw improvement in their glucose, their sugars. I like this photo because this guy participated in one of our studies. This is a study taken from him over across the way at the prevention center. He's participating in our active lifestyle study. This is Gene. He actually came down from Bellingham to participate in the study, multiple trips down from Bellingham to do this. And he lost a significant amount of weight through our program. And it's great to have him, it's a great photo of him. So I get asked a lot, well, but my cancer's already spread to the bone. Is it safe for me to exercise? Well, I would tell people, we think it is. Well, this is actually a study that shows that it is. Again, this was published at the end of last year, 2017. They took men, all of them were on ADT. 1 in 6 of them had received or were receiving chemotherapy for their advanced prostate cancer. They got resistance exercises, weights, cardiopulmonary exercises, and flexibility exercises, which are very important for us. 3-month intervention, not even 6 months. Improved physical functioning and strength. They didn't see in this population that the lean mass, fat mass, and fatigue necessarily improved in this 3-month intervention. But I think what's really important is there was no difference in the adverse events between the groups. The exercise did not lead to more fractures. The exercise did not lead to more bone pain. It was safe, well tolerated, and something you can do. I want to introduce this concept called sarcopenia. As we get older, we all know that our muscles get weaker. We lose muscle mass. This photo, these are CAT scans. So a person is lying on a table here. This is the table they're lying on. So this is their back and this is their tummy. And we're looking at a slice right through about here, looking up the patient's abdomen. And what you see in this younger person these are the paraspinous muscles, some of the more psoas muscles. This is the six-pack muscle up here. These are the obliques. And the distance from the muscle to the skin here is the amount of subcutaneous fat that this individual has. Well, this picture here is an older gentleman on androgen deprivation therapy. It doesn't take a radiologist to see that these muscles are weaker, they're thinner. You can't even see the rectus muscle on this patient hardly. And look at the increased amount of subcutaneous fat. This person is seeing just what I was talking about in the other slides. Decreased muscle mass, decreased lean mass, increased fat mass as a result of ADT. Sarcopenia is a result of, is accelerated by adding ADT, accelerates the aging process. And sarcopenia leads to some of the F words: frailty, falling, fractures. And those put us at risk for fatality. Just published earlier this year. Men randomized on ADT, resistance training versus home stretching. At the start of the study, 44% met the criteria for sarcopenia. At the end of the study, those in the stretching actually had a slight increase in sarcopenia, whereas those in the intervention group saw that the prevalence of sarcopenia dropped from 40% down to 15%. Real changes that you can do. So what are we doing here? We have a couple of different studies. I'm going to briefly talk about each of them. We have one in the metastatic setting. We also have one, Dr. Neuhauser mentioned, in the active surveillance population. The interval study is for those that have metastatic castrate-resistant prostate cancer. Interval stands for intense exercise for survival among men. A lot of the things that I've been showing you in these last few slides have been looking at your quality of your life, the strengthening of your body, the improving of your health. This study is taking it one step further and looking at the role of survival in a randomized setting, looking at survival and quality of life. It's exciting because this is an international study. There's only 5 sites in the United States, and we happen to be one of them. Evan Yu, who you'll be hearing from later on, he is the lead medical oncologist on this. Heather Chang has been helping us get patients on it from her clinic as well. We're very excited about this study. 900 men internationally that they want. Again, primary outcome overall survival, but they're going to look at these other things too. Progression-free survival, symptomatic bony events, what's your pain, fatigue, metabolic and other markers to understand that mechanism that we showed in the complex slide, quality of life and physical functioning. Men come in, and this is an intensive study that we're looking at. And the overall scheme is it's not terribly important, but in the intervention, it's spaced out over the course of a year of both aerobic and anaerobic activity. And the control group is a self-directed exercise program. We're not saying don't exercise, but we're just saying we're going to try to see if you can do it on your own as opposed to having it directed. And there still are psychosocial support and other assessments that are being done during this study. The PAL study, the Prostate Cancer Active Lifestyle Study, is our study in men on active surveillance who are overweight and obese and have elected to do active surveillance. Dr. Neuhauser is one of the main co-investigators. Dr. Lin, who you will hear from later, is the leader at the UW site where we are recruiting patients. Dr. Etzioni, who you heard from earlier this morning, is participating in this as well and helping us with study design and all of our analyses. And this is one of the great things about what we do here. We're all doing this together to help you guys and to help us beat this disease. So the overall goal of PALS is to see if a lifestyle intervention where we help men both through diet and exercise can lose weight and improve some of these biomarkers, quality of life, and potentially also progression of their localized prostate cancer. Dr. Neuhauser mentioned this. This is the exercise facility over across the way. It is it's a really nice facility. I wish we could work out here, but they would leave it only for study participants. So I have to go and pay for my gym. So, but it's a great place to work out. And Matt Van Doren, who is our exercise physiologist, is just fantastic. Those of you that have maybe participated, been with him, he's phenomenal. So both of these studies are actively enrolling. We're not going to have results for several years. These are large studies we're trying to do, but our goal is, like I said, to improve prostate cancer outcomes, but at the end of the day too, we're improving our health, especially in the active surveillance population where we're more likely to die of cardiovascular disease than we are to die of the prostate cancer. We can potentially improve both of those and improve your overall survival, your prostate survival, and your quality of life at the same time. So what kind of exercise do we need to get? American Cancer Society, take part in regular physical activity. After you have treatment, avoid inactivity, return to normal activity as soon as you can. Your goal is 30 minutes of moderate to vigorous exercise 5 or more days a week, and includes strength training, resistance exercises on at least 2 days per week. People always ask, well, what does that mean? What does moderate exercise mean? Traditional stuff, walking 3 to 4.5 miles per hour. I was told once, to try to walk so it's tough to whistle while you're walking. Riding a bike, Yoga is an excellent form. It does not necessarily have to be hot yoga that's painful. It can just be normal yoga too. So I don't use as many free weights. I do more of the Nautilus machines now too. It can be fun. Tennis, I'm wearing a tennis tie. You know, you can play doubles. It doesn't have to be hard singles out there as well. It can be work around the house, you know, so pushing a power lawnmower. So be careful though, but I think that's why it's a power lawnmower, just a push lawnmower, because that can be way too hard. And many of you have to do this, and that's babysit grandchildren, and it is significant exercise, pushing them around or handling uncooperative young children. So this really is on their webpage, and I have 3 kids, so I get a heck of a lot of exercise, and so does my father when he has to watch them. So. But I think what this all shows is that there's not a precise prescription for what type of exercise you need to do. I think it doesn't necessarily matter what it is, just go ahead and do something. And I think this cartoon really says it all. Okay, fellas, calm down. Does it really matter what's better, yoga or Pilates? No, okay? Just do something. So with that, I'll stop.